Today we have with us Dr. Paul Johnson, who is a specialist in telemonitoring. He is also the founder and director of the Maternal Infant Centre for Research and Telemonitoring in Oxford, England. Dr. Johnson recently presented a paper to a conference on Buddhism and science in Bangkok, Thailand. The title of that paper was "Why Do Monks Chant at 6 Breaths a Minute?" Dr. Johnson, do monks chant at 6 breaths a minute? And if so, what is the significance of that?
Well, I've done a very small study measuring heart rate and breathing in monks, and it is true that 8 of 10 monks that I've recorded are breathing at 6 a minute most of the time. Now, I didn't just jump into that. There's been work for a long time, both in the Western world and more recently in relation to yoga, showing that slow breathing, of course, slow diaphragmatic breathing, people have known for a long time, is a very effective way of, one, improving breathing, and two, creating relaxation. But the mechanisms by which it creates relaxation really are still questioned. And one of the observations I wanted to follow up in here was an observation made by some Italian cardiologists who were treating patients with heart failure. Patients with heart failure breathe very badly, we know that. And it's often considered that their pattern of breathing contributes to their demise and death. So they were seeking to try and improve their breathing, and indeed were having some success. But the interesting thing was when they got them to breathe very slowly, and 6 breaths a minute seemed to be quite decisive in this, that their heart failure, their breathing, their oxygen level, their blood pressure came down, their sympathetic activity, in other words, their stress levels came down, and their heart failure improved to the extent that people that were chair-bound, in a sense, got up and walked. And many of them were able to reduce the amount of drugs they'd been on, and drugs have side effects, which we might touch on. So there's a science base for 6 breaths a minute, which I could come back to if you like. Why 6 and not 4, and why not 10? Yes. Big difference. Yeah. But in the process, they had shown that a number of these patients with heart failure found watching a clock, a metronome, to get them to breathe at 6 a minute actually put them to sleep, and they stopped breathing at 6 a minute.
I see.
So somebody was inspired and got a yoga teacher to come in, who started with a mantra, which many of you will know. And the heart failure patient said, "Oh, that's much more interesting than the clock." And many of them were more successfully, if you like, controlled by repeating the mantra.
Okay. Is it accepted that controlled, measured breathing will alleviate heart problems and improve health? Or is it accepted by the medical profession, or is it a sort of a fringe idea at this point?
Well, the evidence base is huge, and it's been done in many cardiac centres around the world. And I emphasize the huge because it is fringe. And for example, in the 2010 guidelines for heart disease in the United States, this is not even mentioned. Yet, dare I say it, some of the people on the board there have done the research, and I've called them up, say, how can you do this? How can you keep on ignoring this benefit? Yes. And I'm afraid what we're talking about is modern medicine and the patterns of modern medicine, the specialization, even more important, the role of pharmaceutical companies. Very hard to reverse a trend.
I see. So it's kind of being brushed aside, perhaps, by the medical profession, and yet it's a very simple and easy and cheap way.
And dare I say, harmless.
And
drugs
harmless.
are not harmless.
Yes, that's true.
Yes, it is being brushed aside by mainstream Western medicine. And by that I would emphasize the United States and Europe and the UK, where I've spent most of my academic life.
Yes. What do you think needs to be done to sort of bring into focus the effectiveness of breathing in treating heart problems?
Not an easy answer. I mean, it is changing. I mean, there are centres that do this, but they are in the minority. I think what is, for example, in the UK, we have totally ignored the health of the nation. Maybe we'll come on to that point. But it's now become a big public health issue because people have realized it's probably social disadvantage, the social divide, which is bringing this home. Because, I mean, we got a situation in the UK where, the life expectancy of the top 20% is 8 years more than the bottom 20%. And yet, now this is important, they both have access to the same health care. That didn't used to be the case. But our very, very expensive healthcare system actually provides health care.
Yeah.
Even worse, and this comes back perhaps to the breathing, is that the bottom 20%, they live a shorter life, live with 17 years of disability and chronic disease.
Is this a problem of lifestyle? As you say, they have the same access to the same medical system, probably genetically similar. What accounts for that difference?
It's clearly lifestyle, but the other element that we miss in the West, and we've talked about breathing. I think the fascinating thing to me about breathing, I've worked in it all my life, but it's only really since I've come to Thailand that I've, dare I say, woken up to the fact that breathing is a powerful connection between the brain, how we think, how we feel, and the rest of our system, including the heart. And a breathing pattern has a huge impact on how efficiently a heart can work. But coming back to the point of social disadvantage, and this is a global issue, is the mind, the mental situation.
I see, yeah.
Thailand was probably one of the first countries to pick up on what the WHO have been saying since 1948.
The WHO being the
World Health Organization.
Yeah.
They defined health, interestingly, as not just the absence of disease, but a state of physical, social, and mental well-being. Now that's lifestyle, and more important, it's the kind of life, the environment that we are living in, and it's pretty self-evident that those at a disadvantage live they're forced into, they have a no-choice poor lifestyle, and that's clearly what we have to change.
I see. Do you think that Buddhist monks have something to teach us and tell us about lifestyle and health and longevity?
I mean, a simple answer is yes, if they also understood what they were doing. I mean, in other words, I think what I'd love to achieve here in Thailand is not merely to learn this, because I've learned so much in 2 years, but is to get I'll call it an academic Buddhist interest in the underlying physiology, so that you're not talking in sort of nice general terms, relax, take the middle way. This is where we can actually use these kind of biological measurements to show the actual physiological benefits of the middle way. Okay. And more important, are we actually walking the middle way? We can talk about it, but are we?
Yes, yeah. You're a specialist in telemonitoring, and you advocate personal biomonitoring as a means of checking on a person's health. And I believe, Dr. Johnson, you have a device, I think you're wearing it now, although we can't see it, but a device to check your heart rate variability, which you've told me is very important. Why is it important, and what does it tell us about health, and why is it superior to the tests that doctors normally use?
Well, first of all, before I show you this, I'm not a gadget person for the sake of being gadgets. The great advantage of telemonitoring and personal telemonitoring, what I will show you, is wireless telemonitoring is where I'm wearing something, or anybody can be wearing it, and it is recording continuously, round the clock, awake and asleep, at work, at play, whatever, you see. And your question about why is this better than what a doctor will measure or nurse in a clinic is actually fairly self-evident, because as everybody knows, if they get excited or they run for a bus or whatever, they know their heart rate changes, they know that their breathing and so on change, they know that. Well, that no doctor in a clinic measures that. It's sit down, take a pulse. Dare I say, even Eastern traditional physicians do more than that. But they take a pulse and write down a number. That's merely an average at the time that they've taken it. Mm-hmm. What we want to look at is the dynamics of change, you know.
Yes. But what will it tell you about your heart? Will it tell you that you've got a heart murmur, or your heart is not functioning properly in some way?
Yes, sorry, I should have answered your first question a bit more clearly. Heart rate variability is the key. I could actually say this is a measurement beyond heart rate, because in health, one can look at what we call the biorhythms within heart rate, and maybe this is the time to show you something.
Yes.
I'm wearing a couple of devices. I'll come back to this one. Mm-hmm. This one here is merely on a belt that's going round my chest. Okay. And I say merely, what it is doing, it's recording my heart rate very accurately. In other words, beat to beat, so I can look at rhythm.
Okay. Is that recording on here, or maybe we can
this is it.
zoom in? And
what this is doing, this will record into its own memory, so that I can look at what happens over days and often weeks. But also, I can look at it. This is now this is me now, if you like. Yes. And here's the classical electrocardiogram that almost everyone has seen before. But what we're taking from that, if you watch this for a while, you'll see that the beat to beat, I'm sitting here talking to you, but my heart rate is actually varying, right?
Yes.
And it should vary if I breathe in, especially slowly, and use my diaphragm, and not just the way Westerners breathe, but use my diaphragm. This will change heart rate, right? It will accelerate, and then I breathe out, and it will decrease again. So I get a wave in heart rate.
Yes.
Now that's a very important function. It's not just interesting. It shows that the heart and the respiration are working together, as opposed to just working, not working together, not synchronized. Also shows that there's some connection between my brain and this too, right?
Yes. Yeah.
Now, if you upset me, that may get interrupted, and this comes back to mindfulness. Is that we should be less upset. I mean, I say that to myself most of the time. Is to not let things upset you, and one of the ways to do that is actually to retrain. And I mean the word retrain breathing, to be diaphragmatic, to be slower, and it's a very calming effect.
Yes.
And you'll actually see it on the heart. So there's much more out of heart rate than most people would believe.
Would this device pick up a heart problem that a doctor in the usual tests that they give you would not pick up?
Yes, because I mean there are two things.